he's right. We reap what we sow. This is what we were left with in California. If people don't go out and vote and help elect people who follow the U.S. Constitution and who are an arm of the people, who do what the people want, not what special interests want, not what unions want, not what the liberal freaks want, I might say, okay? I'm tired of it. When I moved out here from New Jersey to California, two things stood out in my mind. Number one, restrictions and regulations on everything. Everything you can think of. Taxes, restrictions, regulations, fees, tariffs. Anything you can think of that the government can take out of your pocket and into their slush funds, that's what's going on in this country, and I'm tired of it. There's an old saying, as California goes, so goes the country. I say we take back the country. We start here today in Sacramento. Rodney's having microphone problems.
I just wanted to point out, you mentioned the Constitution. I understand you found it recently.
Yes, it was in the trash behind the White House.
Yeah.
Holding around in the sign.
We're supposed to be taking it back soon.
Sorry.
Yeah, no, that's good. It still has those original 3 words on it, doesn't it?
Indeed it does.
We the people. Yep. The noise that we make across America by uniting and getting involved. What Craig said is true. Cheerleaders don't win games. We have to actually do the job. It's out of your comfort zone. It has always been, you don't talk politics at church, at home, at family events. Trust me, I have people on the other side of my family. But then I just decided, you know what? I'm no longer going to follow that politically correct thing. And I'm going to tell the people I go to church with, and I'm going to talk to my pastor about electing legitimate leaders who believe in the same values we do. I think Glenn Beck said it best. He says, you go to church with your family. You go and you pray to God. You take your children, you try and raise them right, and then you've got people in America who cast votes for leaders that they know for sure do not represent their moral value. Why?
Tell me, Rodney.
Because their union told them to, as opposed to something we're supposed to do for ourselves, which is think for ourselves.
Is everybody still free to think for themselves? Is that still legal in this country? Since when did political correctness overtake the First Amendment? Since when do we have to be quiet, what we have on our minds, what we want to say, what we believe in? Why is every time that we believe in something, we have to be quiet in what we believe in? We can't say that, we can't do this. Why? But how come the left can do it back and forth, but we can't? I'm a Republican, but I'm a conservative. That's why I'm a Republican. It's closer to the Republican values than it is to the communist values of the other party.
And speaking of that, and the takeover of our country, and the reason we're trying to take it back, I would actually love to bring up our next speaker. Dr. Ron Tachibana is going to come up. He's a family practice in Sacramento since 1980, and he would like to give you a little rundown of the greatest takeover in American history, Obamacare.
Please give him a nice round of applause.
Thank you. Fellow Americans, I've been asked to address you and speak to Obamacare. Nobody knows exactly what it's going to be, but we do know that they are going to add 30 million people to our overstressed medical system already. We cannot pay for what we already have. How are we going to pay for the extra 30 million people that are coming? We are paying for Obamacare today and continuing to pay until 2014 before anybody sees any kind of benefit from that. Also, they're borrowing or stealing from Medicare $575 billion to try and make ends meet in that. And even with the 30 million people added, there still is a lot of patients who are still left without health care. So it is not comprehensive, and a medical renewal is not able to happen. We don't have the financial as well as the manpower resources to man this program. Why don't we have the manpower? It takes 7 to 10 years to develop a practicing physician. During those 7 years that we are learning how to take care of you, we are accumulating a $300,000 educational debt that we have to start paying as soon as we're done with our training, which makes most of new doctors having to take jobs with large entities and not as primary care physicians in private practice. I've been there and I've done that. Let me ask you a question. How many of you have had trouble finding a specialist to take care of you? I doubt if anybody has had any trouble finding a specialist. Now, has anybody had trouble finding and getting an appointment with a primary care physician? I'm sure that most of you have not had success if you didn't already have a primary care physician. The reason being is that in the last 10 years we have lost approximately 60% of our primary care physicians, and the 40% who are still practicing, about half of them are my age, which means we're ready to retire, and if Obamacare becomes a reality, we'll be forced out of practice, and what's left is very few doctors. I've trained family practitioners since 1980, and very few of them have gone into private practice because they cannot afford to. They are fine doctors, and they find that when they get out in the real world, they're asked to do something that is onerous and not practice what they have learned that is right to do. I have been a part of a organized HMO program, and I know that I could not do that and look myself in the mirror every day. So I went back to private practice to where I can have the loyalty of only my patients to worry about and ensure that their insurance pays for what they have bought. And that's the difference between group health care. These doctors are not that they're not caring, but they are under strict rules to follow the dictums of their organization. Now, a word on California care. California is about $25 billion in the hole and has a $57 billion unfunded pension obligation, and they passed a $200 billion single-payer health care plan. The state of California can't afford to administer Medicare or, Medi-Cal for the poor and indigent. How are they going to pay for and perform for the rest of us? I submit to you that they cannot. There are people who say that doctor shortage can be covered by mid-level practitioners. Mid-level practitioners are good technicians. They can do some of the routine care. I was once a primary care mid-level practitioner. practitioner myself before going to medical school. I went to medical school to find out the whys of what I was doing by rote. A mid-level practitioner are very good, but they still are not doctors. And so that in order to take care of you as best as possible, you still need a leader in the team, which is the doctor. Why is our medical system in debt and as broken as it is? Part of the problem comes because insurance companies have made a mistake in assuming that medical practice or the business model of medicine is linear like every other business. The group health organization in New England had proved early in the 1980s and late in the 1970s that doing primary care prevention decreases the cost for everybody. This is the original HMO concept, which was taken over by the insurance companies and applied the linear business model to. And as a result, all of us are suffering because of that. Instead of taking care of people as we preventively and making us less likely to be sick when we reach my age, that we've ignored all those people for all those times, and now they are coming due and having to be taken care of, and as a result, there is no resources for us. So I submit to you that Obamacare is an overstep and overreach of the Congress's powers. Thank you very much.
Thank you very much for coming and speaking to us today. When it comes to healthcare, I just seriously think that putting the same people who fixed the post office and fixed DMV in charge of healthcare scares the living daylights out of me.
Don't forget the TSA.
Oh yeah, that's always a fun one. Now, read the bill. They don't read the bill. You've got to pass it before you can find out what's in it.
I think Fräulein Pelosi said that, didn't she?
Yeah, something like that, yeah. So, of course, our leader would know more about that. Oh, no, wait, I'm sorry. He's on the golf course today. So, now, as part of the unified groups of people coming in today, you're going to hear a lot of speakers from a lot of different organizations giving you guys a little word of advice, a little bit of education, how to get involved, how to move forward. I want to bring up my next friend. I'm from El Dorado County, and I am very, very proud to say that with people in my county, Roseanne and Doris, raise your hands over there on the side. We have one of the reddest, most conservative counties in California. This last year in our ballot, we actually got together. Dean and Bill Freeman right here in front from the Tea Party in the Hills. Very proud Tea Party patriots. Not a single conservative, and I use the word conservative, lost their election in El Dorado County this last year. If we can come together like we did in El Dorado County and actually move this base forward, we can take back our country because we did it in our county, and it can happen everywhere, trust me. It is all about the people. It is not any one individual. Now, the second group in our county, because we actually are red enough to have 2 Tea Party Patriot groups that work in tandem, united with the Republican Party of El Dorado County.